Hello, I'm Dr. Beth Colby from Talk Mental Health. Dysgraphia is a specific learning disability that causes impaired writing or spelling or both. In a person with dysgraphia, the ability to acquire language and to express oneself using written language is impaired. The intelligence is normal or above average. People with dysgraphia know how to read, write, identify letters and words and spell, but they have difficulty processing the words and writing. A person with dysgraphia finds it difficult to form words when writing and may use capital letters incorrectly and use a mixture of cursive, which is joined up, and non-cursive writing. Letters may have incorrect sizes and there may be incorrect spacing between letters and words. Writing may not stay within the lines and the writing may be illegible. People with dysgraphia find it hard to process what they are going to write, and they may make spelling mistakes, miss out a word in a sentence or letters in a word, or even use the wrong word. They find it hard to visualise and copy words, write slowly, holding the pen tightly with an awkward hand or body position, and may watch their hand and say the words out loud when writing. They may get hand cramps. Because of the effort taken to write words, when they are writing they may not be able to concentrate on other things and therefore miss out something that's being said when note-taking. Children with dysgraphia may have a problem with storing words in their working memory or may have difficulty forming permanent memories of written words. The name for this is orthographic coding. They may also have difficulty planning sequential finger movements. Adults may get dysgraphia following a head injury or stroke. It's also known as agraphia. Injury to the brain's left parietal area will result in agraphia. Although the intelligence in a child with dysgraphia is normal or above normal, they may have other specific learning disabilities, such as dyslexia. It can also occur with selective language impairments, with learning written and oral language skills, OWL. OWL or OWL symptoms include trouble placing words in the right order in a sentence and difficulty remembering words. It's really important that a child receives a diagnosis of dysgraphia as early as possible to prevent low self-esteem and so that they can receive and implement strategies that will reduce the impact on their learning and their everyday life. The diagnosis involves several specialists, including the GP or family doctor, paediatrician, occupational therapist, and educational psychologist. Academic tests, fine motor skills tests, IQ tests and writing tests may all be used, as well as observing the pencil grip and hand and finger position whilst writing, and of course looking at the writing once completed. So the occupational therapist is an important person in prescribing treatment for a person with dysgraphia. They may teach a child to hold a pen or pencil in a different way to make writing easier. They may get them to work with modelling clay, drawing lines within mazes, connecting dots in puzzles. There are also several writing programmes that allow both adults and children to write neatly on paper. For some people, it is a lifelong challenge to be able to improve their writing ability. Things that will help would be somebody designated in the classroom to be a note taker, using a computer for notes and assignments instead of a pen and paper, having extra time on tests and assignments. The lecture notes already be printed out for the student, having special grips on pencils and pens and other writing instruments, using paper with raised lines to make it easier to keep within the lines. I hope you found this interesting. Thank you for listening. Bye for now.